1.
The nurse on a medical surgical unit is prioritizing care for 4 patients. Which patient should the nurse assess first? 1. A patient with a history of hypertension complaining of a mild headache. 2. A patient newly admitted with shortness of breath and oxygen saturation of 89%. 3. A postoperative patient requesting pain medication. 4. A patient scheduled for discharge in 2 hours? Answer. The nurse should first assess the patient newly admitted with shortness of breath and oxygen saturation of 89%. Rationale: airway and breathing concerns take priority. Low oxygen saturation indicates impaired gas exchange, which requires immediate intervention.
2.
A nurse is delegating tasks to an experienced, unlicensed assistive personnel, UAP. Which of the following tasks is appropriate for the UAP? 1. Administering oral medications. 2. Performing a sterile dressing change. 3. Assisting a patient with ambulation after surgery. 4. Developing a plan of care? Answer. The nurse should delegate assisting a patient with ambulation after surgery to the UAP. Rationale: UAPs can assist with activities of daily living such as ambulation. However, tasks requiring assessment, evaluation, or sterile technique are beyond their scope. 3. The charge nurse is assigning patients to a float nurse from the pediatric unit. Which patient is most appropriate for this nurse? 1. A patient with chest tubes requiring frequent suctioning. 2. A stable postoperative patient recovering from an appendectomy. 3. A patient receiving chemotherapy with neutropenic precautions. 4. A patient with a new tracheostomy? Answer. The float nurse should be assigned to the stable postoperative patient recovering from an appendectomy. Rationale: a float nurse should care for patients whose needs match their experience. A stable postoperative patient is the least complex and safest choice.
4.
The nurse is planning care for 4 clients. Which client should be seen first? 1. A diabetic patient with a blood glucose of 68 milligrams per deciliter. 2. A patient with a temperature of 101.2 degrees Fahrenheit requesting a blanket. 3. A patient with a wound dressing change scheduled. 4. A patient who needs assistance to the bathroom? Answer. The nurse should first see the diabetic patient with a blood glucose of 68 milligrams per deciliter. Rationale: hypoglycemia is potentially life-threatening and requires immediate intervention to prevent complications such as seizures or loss of consciousness. 5. A newly licensed nurse is working under the supervision of a preceptor. Which of the following actions requires immediate intervention? 1. The nurse asks the UAP to record intake and output. 2. The nurse delegates vital signs to a UAP. 3. The nurse administers 4-push medication without checking compatibility. 4. The nurse explains a procedure to a patient? Answer. The preceptor should immediately intervene when the nurse administers 4-push medication without checking compatibility. Rationale: administering 4 medications without verifying compatibility can lead to life-threatening drug interactions and patient harm. 6. During change of shift report, the nurse learns that 4 patients require attention. Which should the nurse see first? 1. A patient who is anxious about surgery. 2. A patient whose 4 has infiltrated. 3. A patient with a new onset of slurred speech. 4. A patient requesting discharge teaching? Answer. The nurse should first see the patient with a new onset of slurred speech. Rationale: slurred speech may indicate a stroke or neurologic emergency, requiring immediate assessment and activation of emergency protocols. 7. The nurse is caring for 4 patients. Which task is appropriate to delegate to the UAP? 1. Feeding a patient with dysphagia. 2. Measuring and recording output from a Foley catheter. 3. Assessing a patient's pain level. 4. Teaching a patient how to use a walker? Answer. The nurse may delegate measuring and recording output from a Foley catheter to the UAP. Rationale: measuring output is a non-invasive, routine task that falls within the UAP's role. Assessment and teaching are responsibilities of the RN.
8.
A nurse is supervising a student nurse during patient care. Which action by the student requires correction? 1. Placing the call light within reach. 2. Documenting before administering medication. 3. Identifying the patient using two identifiers. 4. Washing hands before a sterile procedure? Answer. The nurse should correct the student for documenting before administering medication. Rationale. Documentation must reflect actual events. Pre-charting is unsafe and unethical, as it can lead to inaccurate records and legal issues.
9.
The nurse is caring for a patient with a chest tube. Which of the following actions should be assigned to the LPN? 1. Administering a Scheduled 4 antibiotic. 2. Assessing respiratory status post-insertion. 3. Reinforcing teaching about deep breathing. 4. Initiating a blood transfusion? Answer. The LPN may be assigned to reinforce teaching about deep breathing. Rationale. LPNs can reinforce education and perform stable care, but initial teaching for medications and complex assessments should be done by RNs.
10.
A nurse manager observes a nurse discussing a patient's condition loudly at the nurse's station. What is the best initial response? 1. Report the incident to administration. 2. Counsel the nurse privately about HIPAA. 3. Ignore the situation. 4. Confront the nurse in public? Answer. The best response is to counsel the nurse privately about HIPAA. Rationale. Addressing the issue privately maintains professionalism and provides an opportunity to educate the nurse on confidentiality and legal responsibilities. 11. The RN is prioritizing care on a busy medical surgical unit. Which of the following should the RN delegate to an LP1? Initiating a care plan for a new admission. 2. Evaluating the effectiveness of pain management. 3. Administering oral medications to stable patients. 4. Performing initial assessment post-surgery? Answer. The RN may delegate administering oral medications to stable patients to the LPN. Rationale. LPNs can administer medications to stable patients, but initial assessments, care planning, and evaluation are RN responsibilities. 12. A nurse is caring for a patient who is refusing treatment. What is the most appropriate action? 1. Proceed with treatment to avoid harm. 2. Notify the provider and document the refusal. 3. Persuade the patient to comply. 4. Involve family members to convince the patient? Answer. The nurse should notify the provider and document the refusal. Rationale. Patients have the right to refuse treatment. The nurse must honor autonomy, notify the healthcare provider, and document accurately. 13. A patient is being transferred from ICU to a medical surgical floor. Which task should the RN perform first? 1. Give report to receiving nurse. 2. Update the care plan. 3. Verify that patient belongings are packed. 4. Review the patient's current status? Answer. The RN should first review the patient's current status. Rationale. Assessing the patient ensures stability and safe handoff before transfer. This aligns with the principles of continuity and quality of care. 14. A nurse is precepting a new graduate. Which behavior by the new graduate requires intervention? 1. Asking for help with unfamiliar procedures. 2. Delegating vital signs to UAP. 3. Performing dressing changes without gloves. 4. Using SBAR format during handoff? Answer. The nurse should intervene when the new graduate performs dressing changes without gloves. Rationale. This is a breach of infection control protocols and patient safety standards. PPE must be used during procedures involving bodily fluids. 15. A nurse is assigning tasks on a unit with high patient acuity. Which task should be assigned to an experienced float LPN? 1. Teaching insulin administration. 2. Monitoring a stable post-op wound. 3. Initiating IV therapy. 4. Titrating vasoactive drips? Answer. The LPN should be assigned to monitor a stable post-op wound. Rationale. LPNs can provide routine care to stable patients, including wound care, but teaching, initiating IVs, and titrating drips are RN tasks.
16.
During a code blue, which role is most appropriate for the UAP? 1. Administering chest compressions. 2. Defibrillating the patient. 3. Administering emergency medications. 4. Documenting the code events? Answer. The UAP may assist by administering chest compressions. Rationale. UAPs trained in basic life support can perform CPR, Other actions require professional licensure and training. 17. A nurse observes a coworker wasting narcotics without a second witness. What is the most appropriate initial action? 1. Ignore the behavior. 2. Confront the coworker directly. 3. Report to the charge nurse or supervisor. 4. Inform the patient? Answer. The nurse should report to the charge nurse or supervisor. Rationale. Wasting narcotics without a witness may indicate diversion. Reporting ensures accountability and protects patient safety.
18.
A nurse is caring for a patient receiving home health services. Which action ensures continuity of care? 1. Instructing the patient to call with questions. 2. Scheduling appointments based on availability. 3. Updating and sharing the care plan with the home health team. 4. Encouraging self-care independence? Answer. The nurse should update and share the care plan with the home health team. Rationale. Effective communication and shared documentation among providers are essential for continuity and coordination of care. 19. A patient is admitted for suicidal ideation. Which task can the nurse delegate to a UAP? 1. Monitoring for suicidal behavior. 2. Conducting a safety assessment. 3. Reporting abnormal behavior to the nurse. 4. Explaining suicide precautions? Answer. The nurse may delegate reporting abnormal behavior to the nurse to the UAP. Rationale. UAPs can observe and report, but interpretation and assessments must be completed by licensed personnel.
20.
The RN is planning care for a patient with multiple chronic illnesses. Which intervention is most appropriate to assign to case management? 1. Administering medications. 2. Coordinating specialist referrals and follow-up. 3. Monitoring blood pressure daily. 4. Inserting a urinary catheter? Answer. The RN should assign coordinating specialist referrals and follow-up to case management. Rationale. Case managers coordinate comprehensive, interdisciplinary care and ensure proper follow-up, which improves outcomes in complex cases. 21. A nurse is caring for 4 patients. Which one should the nurse assess first? 1. A patient who reports chest pain with shortness of breath. 2. A patient who needs assistance with meals. 3. A patient scheduled for a routine dressing change. 4. A patient complaining of constipation for 2 days? Answer. The nurse should first assess the patient who reports chest pain with shortness of breath. Rationale. Chest pain with shortness of breath is a potential sign of a cardiac or respiratory emergency and requires immediate assessment and intervention.
22.
A nurse is supervising a newly hired UAP. Which action by the UAP would require immediate intervention? 1. Assisting a patient to ambulate with a walker. 2. Offering a patient water before swallowing pills. 3. Placing soiled linens on the floor. 4. Reporting abnormal vital signs to the nurse? Answer. The nurse should immediately intervene when the UAP places soiled linens on the floor. Rationale. This practice increases infection risk and violates standard infection control procedures. 23. A patient is being discharged with home oxygen therapy. Which task should the RN perform? 1. Teaching the patient about fire safety with oxygen. 2. Adjusting oxygen flow during transport. 3. Transporting the patient to the car. 4. Ensuring the patient's room is clean? Answer. The RN should teach the patient about fire safety with oxygen. Rationale. Teaching about safety and use of medical equipment falls within the RN scope, especially when it affects patient safety at home.
24.
During a multidisciplinary team meeting, which patient concerns should the nurse address first? 1. Delayed insurance approval. 2. Lack of family support for home care. 3. New confusion and disorientation. 4. Inadequate transportation for follow-up? Answer. The nurse should first address the new confusion and disorientation. Rationale. Acute changes in mental status may signal a serious underlying condition and must be prioritized before logistical or psychosocial concerns.
25.
A nurse is delegating to a UAP on a busy unit. Which task is appropriate to delegate? 1. Obtaining a blood glucose level using a glucometer. 2. Assessing for pedal pulses. 3. Educating the patient about diabetic foot care. 4. Adjusting oxygen flow rate? Answer: the nurse may delegate obtaining a blood glucose level using a glucometer. Rationale: UAPs may perform point-of-care testing if properly trained and under supervision. Assessment and education remain the RN's responsibility. 26. A nurse manager is reviewing documentation practices. Which charting behavior requires correction? 1. Documenting after completing a procedure. 2. Using approved abbreviations. 3. Charting subjective statements as quotes. 4. Documenting care before providing it? Answer: the nurse manager should correct the behavior of documenting care before providing it. Rationale: pre-charting is inaccurate and unsafe. Documentation must reflect the actual time and completion of care provided. 27. A patient with new-onset seizures is admitted. Which action should the RN perform first? 1. Pad the side rails. 2. Notify the physician. 3. Place in 4-line. 4. Obtain a history from the family? Answer: the RN should first pad the side rails. Rationale: ensuring safety is the priority in seizure management to prevent injury during an event. 28. A nurse is preparing to transfer a stable patient to a rehabilitation facility. What is the priority action? 1. Copy the medical record. 2. Complete discharge teaching. 3. Ensure continuity of medications. 4. Confirm transportation arrangements? Answer: the nurse should ensure continuity of medications. Rationale: maintaining consistent medication regimens prevents adverse effects and supports therapeutic outcomes during care transitions. 29. The nurse assigns a new LPN to a patient with chest pain. Which aspect of care should the RN retain? 1. Monitoring blood pressure. 2. Collecting a health history. 3. Administering oral medications. 4. Reinforcing dietary education? Answer: the RN should retain the task of collecting a health history. Rationale: comprehensive assessments require RN-level training and critical thinking, particularly in acute scenarios like chest pain. 30. The nurse is caring for 4 patients. Which one is a priority based on safety needs? 1. A confused patient wandering in the hallway. 2. A patient needing a meal tray delivered. 3. A patient with a stable wound dressing. 4. A patient asking about discharge time? Answer: the confused patient wandering in the hallway is the priority. Rationale: patient safety is at risk due to the potential for falls or injury. Confusion and mobility issues require immediate attention. 31. A nurse witnesses a colleague leaving a medication unattended in a patient room. What is the appropriate first action? 1. Report to the Board of Nursing. 2. Remind the colleague about safe practice. 3. Call the supervisor. 4. Discard the medication? Answer: the nurse should remind the colleague about safe practice. Rationale: addressing the behavior promptly and directly promotes patient safety and provides an opportunity for immediate correction and education. 32. A nurse on a surgical floor receives 4 patient calls at once. Who should the nurse address first? 1. A patient reporting a saturated abdominal dressing. 2. A patient asking for a sleeping pill. 3. A patient needing help to the bathroom. 4. A patient requesting a warm blanket? Answer: the nurse should first assess the patient with a saturated abdominal dressing. Rationale: excessive drainage may indicate hemorrhage or dehiscence, requiring prompt assessment and potential intervention. 33. A nurse is working with a social worker to discharge a patient. What should the nurse prioritize during discharge planning? 1. Patient's financial resources. 2. Availability of caregiver support. 3. Medical follow-up appointments. 4. Patient understanding of medications? Answer: the nurse should prioritize the patient's understanding of medications. Rationale: medication errors are common post-discharge. Ensuring patient understanding prevents complications and readmissions. 34. A new nurse is unsure how to operate a PCA pump. What is the most appropriate action? 1. Ask a peer to operate it for them. 2. Contact the manufacturer. 3. Review the policy and seek guidance from a preceptor. 4. Attempt to figure it out independently? Answer: the nurse should review the policy and seek guidance from a preceptor. Rationale: safe practice includes knowing when to seek help and verifying procedures before administering complex interventions.
35.
The nurse receives a report about 4 patients. Which one requires immediate attention? 1. A patient with a respiratory rate of 8 per minute. 2. A patient requesting a PRN analgesic. 3. A patient with a heart rate of 102 per minute. 4. A patient with a mild headache. Answer: the patient with a respiratory rate of 8 per minute requires immediate attention. Rationale: respiratory depression can be life-threatening and may indicate oversedation or underlying pathology needing urgent care. 36. A patient is scheduled for surgery and has questions about the procedure.
What should the nurse do? 1.
Explain the surgical steps. 2. Reinforce what the surgeon previously taught. 3. Provide reassurance without explanation. 4. Postpone the surgery until all questions are answered. Answer: the nurse should reinforce what the surgeon previously taught. Rationale: nurses can reinforce teaching but cannot provide informed consent explanations, which is the responsibility of the surgeon. 37. A nurse finds an unresponsive patient who has a do not resuscitate (DNR) order. What action should the nurse take? 1. Initiate CPR. 2. Contact the physician. 3. Provide comfort measures and document findings. 4. Call a code blue? Answer: the nurse should provide comfort measures and document findings. Rationale: a DNR order indicates that CPR should not be performed. The nurse's role is to ensure dignified care and accurate documentation. 38. A nurse is leading a quality improvement team to reduce medication errors. Which strategy is most effective? 1. Increasing staff meetings. 2. Disciplining staff after errors. 3. Implementing barcode scanning. 4. Encouraging anonymous reporting? Answer: implementing barcode scanning is most effective. Rationale: technology like barcode scanning significantly reduces human error and enhances medication administration safety. 39. A UAP informs the nurse that a patient refuses to eat. What is the nurse's best initial response? 1. Document the refusal. 2. Instruct the UAP to try again. 3. Assess the patient to determine the reason. 4. Notify dietary services? Answer: the nurse should assess the patient to determine the reason. Rationale: direct assessment by the nurse ensures the underlying issue, e.g., nausea, pain, depression, is addressed appropriately.
40.
The nurse manager is conducting peer evaluations. What should be the priority focus during the review? 1. Friendliness with coworkers. 2. Timeliness of arrival to work. 3. Adherence to patient safety protocols. 4. Participation in unit events? Answer: the nurse manager should prioritize adherence to patient safety protocols. Rationale: while professionalism matters, patient safety is the cornerstone of nursing practice and the primary focus of performance evaluation.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.